Hello, I'm Dr. Ellie Cannon. I'm an NHS GP, and I'm delighted to say I am one of the millions of people in the UK who has had their COVID vaccination. I'm here today talking to Jaz Owen. Jaz is a mental health support worker who works with the homeless community, and we're going to be talking about vaccinations within the social care setting. Jaz, hi, how are you? It's nice to meet you.
I'm not too bad. It's nice to meet you too. How are you doing?
Yeah, I'm good, thank you. So tell us about your work.
I work at Hopkinson House, which is a part of Look Ahead, and I support people with a long history of rough sleeping with complex needs. So mental health issues, substance misuse issues, and a long histories of trauma.
And it's obviously very important that yourself and your colleagues are vaccinated. So tell us about that. Have you had your first vaccination?
Yes, I had my first dose, and I'm just about to have my second, which I'm really excited about.
Great. And how do you feel having had that?
Honestly, relieved, um, happy that I was offered it so soon, and yeah, I'm excited to just get to the end of this pandemic eventually.
Yeah, absolutely, aren't we all? Now, I know you wanted to ask me some questions about vaccination from your point of view and from your colleagues' point of view. So go ahead.
Well, I guess the big one that people are wondering is, are the COVID vaccines safe?
Yes, they really are. The COVID vaccines are safe. Both the Pfizer and the AstraZeneca vaccine have been through incredibly rigorous trials and safety checks. Those safety checks continue and they're an ongoing process. So we always have something called surveillance. But we also have in the UK the MHRA, who checks all the safety data and wouldn't have allowed the trials to carry on unless they were proven to be safe. So now we have data both from science and from the trials, but also we have real world data. So people like you and me who've been vaccinated and all the millions of others, both in the UK and around the world, who are fine. So yes, they are safe.
Are they effective against COVID-19?
I feel really positive that they have now been proven to be effective. They were proven within the trials, but we can see now in the UK and around the world that the Oxford vaccine, the AstraZeneca vaccine, and also the Pfizer-BioNTech vaccine is reducing hospitalizations and reducing deaths and reducing severe illness. And that's really what's important with vaccination. There may be some cases of mild illness, but the most important thing, the thing that was so terrible for all of us about COVID, obviously, was the mortality and the severe illness.
What's being done at the moment to drive uptake of the vaccine in multicultural communities?
So I know the Department of Health and the NHS are working really hard to go into those communities. We have vaccination hubs within places of worship, within mosques, within community centres, with cultural leaders being the first to take up the vaccine and welcome in their communities. I have colleagues who have spoken to their own communities within their language and bearing in mind cultural sensitivities in order to help those groups understand just how important the vaccination is. And often many members of those communities, because of long-term health conditions, they are actually in the priority group for vaccination, possibly due to long-term health conditions like type 2 diabetes, which can be prevalent. So we are working really hard to get into the communities who actually need it the most. Jaz, I wanted to ask you some questions about COVID and vaccinations from your point of view, from within social care. And what would you say to your colleagues about having the vaccination and your experience?
Yeah, I encourage anyone who works in the health and social care sector or on the front line to get the vaccine when notified.
Now, obviously, you work with particularly vulnerable people who the NHS and the Department of Health really want to protect from COVID. How have you been able to help the homeless people you work with access the vaccination?
Well, I think we realised that, we had to think creatively. A lot of the people I support have been street homeless for many years, so it's about getting them access to a GP. We've had really great success with outreach inside hostels, doing vaccines in-house where people are staying. The homeless people that we support have, understandably, a lot of questions because they are cut off from the mainstream media and the news. And there was a lot of confusion and fear surrounding the pandemic and the vaccine. So really, as staff members, we had to just keep ourselves informed and educated about, the ever-changing news, the ever-changing rules, so we could pass that on to our residents.
And we also know that people with mental health problems, with mental illness, are more vulnerable to COVID and are a priority group for vaccination. How have you been able to reassure people with mental health conditions about the vaccination?
Again, I think it's a matter of educating the people that we support. A lot of the fear around the vaccine comes from the fact that, maybe they're not the best educated on the science. And it's just been about reassuring them that this is for the greater good, for their own health, and for their own safety.
And have you found amongst your clients, amongst the people who you look after, has the vaccine uptake been pretty good?
We expected a challenge, but it turns out that our clients, just as we are just as excited to be vaccinated and to sort of return to normal after this pandemic. So we've had quite good uptake in my service especially. We now have almost all residents vaccinated out of 60 plus. So that's a real success for us.
It sounds like you've been doing brilliantly, really.
If everyone gets the vaccine, will we find our way out of this pandemic?
Yes, the vaccination really is the answer to getting out of the pandemic. At the moment, we're having to rely on what we call non-pharmaceutical interventions, so hand washing, social distancing, masks, and lockdowns, because that prevents the virus spreading. But as more and more of us are immune through vaccination, then in fact we will eventually be able to come out of the pandemic, come out of the restrictions, and that is really thanks to vaccination.
If I was looking for more information on the vaccine, where should I go?
There's plenty of information on the COVID vaccine on the NHS website. So that's nhs.uk/COVID vaccine.